I'll call to order the April 7th, 2020 meeting of the Santa Barbara County Board of Supervisors. Will the clerk please call the roll?
Mr. Lavanino,
Here.
Mr. Williams, Ms. Hartman,
Here.
Mr. Adam,
Here.
Chair Hart.
Here. At this time, please stand and join the board in pledging allegiance to the flag. Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The next item of business is approval of the minutes of March 24th and March 31st, 2020. Is there any discussion? Can I please get a motion?
I move approval.
Is there a second?
Second.
Motion's been made and seconded. Would we please have a roll call?
Mr. Lavanino, Mr. Lavanino,
Aye.
Mr. Williams,
Aye.
Ms. Hartman,
Aye.
Mr. Adam,
Aye, with an abstention on the last item.
and Chair Hart.
Aye. CEO Miyasato, is there a CEO report today?
There's no report this morning, Chair Hart.
Thank you. Madam Clerk, any announcements or changes to the agenda?
Chair Hart and members of the board, I do have a couple quick announcements this morning. We posted an addendum on Friday amending today's Board of Supervisors agenda, correcting a case under conference with legal counsel existing litigation to reflect the correct name, A.C. et al. v. County of Santa Barbara et al., United States District Court for the Central District of California, case number 218 CV 03694 SK. In addition to that amendment, we added an additional administrative agenda item, A23. This is from Community Services. It is to consider recommendations regarding the acceptance of state COVID-19 emergency homelessness funding. In addition to our addendum on Friday, I have a couple other quick announcements on item A5 from the County Executive Office. This is to consider recommendations regarding COVID-19 related appropriations, and it is listed on our agenda as a 4/5 vote required, and this is actually a majority vote, so just reflect that in our motion. And last, I did want to just remind the public again today the alternative methods of public participation in our Board of Supervisors meetings, which is posted on the Clerk of the Board website, as well as page 2 of our agenda. And if the public wishes to make a general public comment or comment on a specific agenda item, to submit an email to the Clerk of the Board's office at sbcob@countyofsb.org, and your comment will be placed into the record. Additionally, if you would like your email to be read into the record, to email the Clerk of the Board office at sbcob@countyofsb.org, and state in the body of your email that you would like that to be read into the record. And last method of participation is by phone. If you would like to make a comment by phone, please call our office, 805-568-2240, and that is also scrolling on the top of the TV at the moment. State your name, your phone number, and which item you'd like to speak on, and the clerk will call you at the appropriate time. Please make every effort to be available and mute all streaming devices once it is your turn to speak. And that is all my announcements.
Thank you, Madam Clerk. Next item is approval of the administrative agenda. Do any board members request to pull any items from the administrative agenda? Seeing no one, does Madam Clerk, are there any members of the public that would like to request to pull items on the administrative agenda?
Chair Hart and members of the board, we have no requests to speak on the administrative agenda.
Okay, can I please get a motion to approve the balance of the administrative agenda?
Move A1 through A23.
Motion's been made
Second.
and seconded. Roll call vote, please.
Mr. Lavanino,
Aye.
Mr. Williams,
Aye.
Ms. Hartman,
Aye.
Mr. Adam,
Aye.
Chair Hart.
Aye.
Motion passes unanimously.
Now is the time for members of the public to speak to the board on items that are not on the agenda. Are there any regular items that, or requests to speak on items for today's agenda?
Chair Hart and members of the board, I do have one request to speak on general public comment today, and it is a letter to be read into the record.
Thank you very much.
And this letter is from Bobby McGinnis. On March 24, 2020, the Santa Barbara County Supervisors adopted an ordinance that supported Governor Gavin Newsom's statewide no eviction policy for tenants, which expires on May 31, 2020. To support your local landlords and property owners who rely on tenants' rents to pay their bills, please close Treasurer Harry Hagan's office from April 10th until May 31st, 2020. We understand that Santa Barbara County cannot change the delinquent date for property taxes. However, the County Board of Supervisors can shut down the Treasurer's office for 60 days so that property taxes cannot be collected automatically, extending the delinquent date without penalty. Please give property owners and small businesses the same relief as tenants. This is equal protection under the law. Thank you, Bobby McGinnis, Chairwoman of the Santa Barbara County Republican Party.
Thank you, Ms. McGinnis. Next item is Department Item 1. Would the clerk please read the item into the record?
Chair Hart, members of the board, Departmental Item Number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding a coronavirus disease 2019 COVID-19 update.
Thank you. CEO Miyasato, do you want to introduce this item?
Board members, as you know, every board agenda, we are providing you the latest information we have on our COVID response, and so I'm going to hand it over to our Public Health Director, Dr. Von Del Reynoso, and I think, are you able to get the screen up? There you go. Thank you.
I was looking for the pointer.
Okay.
Dr. Del Reynoso, thank you for being here.
Thank you. Good morning. My weekly update. It's a little dense this week, so bear with me. I want to start off by, again, showcasing the new and improved data information site, and you can access that at publichealthsbc.org/dashboard. And there we have graphics that captures total cases, active cases, cases by age groups, and cases by geographic areas. It's a really neat portal, because for those who would like to calculate cases in terms of percentages, you can hover over the icon and you can get a percentage of testing that's positive, that's negative. The situation status as of, the wrong date. But as of 4/6 at 12 p.m., we have 192 cases confirmed, 34 hospitalization, and unfortunately 2 deaths, and 42 fully recovered cases. I wanted to start by also giving the landscape of our current hospital beds. So right now in our county, we have 376 med-surg beds and 91 ICU beds. These are regularly licensed beds, and we're operating at about 40% capacity. And of the number of ventilators available, meaning not in use, from our ReadyNet platform this morning, there are 50 still available. Regional characteristics relevant of COVID-19. We have an older population. Roughly 15% of our residents are over the age of 65. And so why this is important, older age groups we are seeing in literature are more likely to get COVID-19 and are more likely to have serious health impacts from that infection. And a good thing, our county has lower population density as compared to, say, New York or San Francisco or LA, and that will be a strength and asset as we manage COVID-19. Okay, so before I launch into our modeling, I want to give a word of caution. Modeling whatever model you look at, they're really based on real-time data. And so the models that I'm about to show you were accessed with data from the 6th. And at any given time, when you run models with using real-time data, you get different results. So what I'm showing to you today looks a lot different than what I shared with you last week, and will most likely look different next week. In terms of projections, this is a very fluid situation. Long-term projections may not give us the precise data that we're looking for because we don't know, there's a lot of uncertainty around how COVID-19 infection rates happen, the transmission, and even the how do we gauge the social distancing measures. So these are just caution as I share models with you that they are not engraved in stone, that they're fluid and they may change from day to day given our different number of cases and infections and hospitalization rates. So the PEN model is a model that we have been recommended by the California Department of Public Health. So these are the variables I'd like to walk you through that we input into the model in order to get the graphics that I'll be showing you. We input in the current number of people hospitalized due to COVID-19. And when we ran this model, it was 27. Doubling time, it's 6 to 7. Current hospitalized patients, 27. Social distancing is a gauge of what percentage reduction in social contacts moving forward. Hospitalization rate, the state recommends 5 to 20. We're using 10% as a middle. ICU percent of total infections. State recommends 1% to 5%, and based upon our local clinical experts, we are inputting 3% in. Ventilated percent, meaning the number of people on ventilators, anywhere from 1 to 5%, and we base again on local information, are landing on 2%. Average length of stay in the hospital, the state recommends 7 days, and it is the default of the model. Average days in ICU is 9 days, and that's a default of the model. Average days on the ventilator is 10 days, although we have seen 11 days, but we're keeping an eye on that. Hospital market share, this is 100%. This is really assuming that everyone who gets sick in Santa Barbara County will seek care at a Santa Barbara County hospital. Regional population, 450, and currently known regional infections, that's 174.
Not everybody sick is going to go to a hospital. Okay.
So using the PEN model, this is a rough estimate of what we can anticipate. And again, this model, typically this model is to be run at 100 days. But to get a complete bell curve, I ran it for 200 days. So the preciseness of going beyond the 100 days may be a little off. So on the first is 40%. So if we had 40% compliance with our social distancing, you get this nice brown curve that's pretty high. And here at 40% social distancing, we're anticipating that on June 25th, we will peak with our hospitalization census right here. And on that day or a day after, on the 26th, the ICU census will peak at 768, with ventilation needing 566 on June 27th. So the brown is if we assume that 45% of our county residents are adhering to our social distancing guidelines, we see a little bit more of a flattened curve as we anticipated. So here on the brown curve, hospitalization will peak on 682 on July 16th, with census peaks at 438 on July 17th, with ventilated census peaking at 323 on July 18th. The blue line is the 50%. If 50% of our county were to adhere to social distancing measures, we see an even further flattening of the curve. So here we see a peak at further out on August the 20th, with hospitalized at 274, with census peaking at 176, and with ventilated census peaking at only 130. If we are really ambitious, and we could see even a 5%. So what would a 5% increase in our social distancing gain? Right here, way low, it's practically invisible. It's this really flattened line below. So I wanted to show this to demonstrate the power of social distancing and all our health officer orders. And this is what we're attempting to do. Later on, I'll show you why this is critical, because this will be layered on top of our system's capacity at current time. Again, breaking it down, the graphs that I just shared with you. So that was the Penn model. So this is the University of Washington model. So this model is what we are seeing on the national level. This is the model that frequently the White House will display in their press briefing, as well as multiple states will display in their press briefing. And again, just to demonstrate, this is what it looks like on the national front. But even this was updated a couple days ago. And from one rendition to the next, as we get more data and as we fine-tune the model, we see an update representing a 46% decrease in hospital census. So what that tells me is that as we refine our models with more data, we get better predictions, and the resource requirement is not as great as when we anticipated at the beginning of the COVID-19 response a month ago. I can't believe it's been a month, but it's been a month. So what might be more interesting is looking at the University of Washington model and how it plays out in California. Again, this model runs states and national. So we see that on March 19th, our governor issued a stay-home order. Educational facilities closed on the 19th, non-essential services closed on the 19th, and travel was severely limited. So this model anticipates that on April 14th or 15th, that's the peak need for resources. And given all the efforts that our state government has done, we don't see in this model a need for bed shortage or ICU bed shortage, but we do still see a need of ventilators. So what does that mean for Santa Barbara County using this national and state model? Well, this model doesn't allow for the variables to be changed, so the best that we can do is estimate based on our percentage of population compared to the state. So we have about a 1.13% population of the state. So if you calculate back the peaks hospitalized census, we're anticipating 140 on roughly the 26th of Wednesday. April 26th, and this is similar to what we had predicted a week ago. Peak ICU census at 21, peak ventilator needs at 17, and anticipated number of deaths by August the 4th around 57. So this is extrapolation of a national and state model. So what does this all mean, running models? Well, we run models because we want to, even though the data may not be precise, we want to get a gauge on how these models can assist us in doing hospital surge planning, in standing up alternate care sites, in acquisition of medical equipment. Okay, so the current surge capacity in our county, these are beds at the 5 hospitals in our county, and these are all have been verified by the hospitals in question. So we're looking at, in terms of med surge capacity, we have pre-existing means this is what the number of licensed beds there are in the county. So if we set aside 40% of the number, the 376, and the remaining 60% would then be available for COVID-19 response. So we're looking then at the 226. Similarly with ICU, we have 91 beds licensed for ICU. And if we take 60% of that, we get 55. So altogether, including 60% of licensed beds and the capacity of the hospitals to turn different spaces in the hospitals for med-surg or for ICU, we get a total of 699. So this number, again, has been verified by the CEOs and their staff at the three hospital systems. So, and that's a good thing. This was not we did not know this a week ago. So in close partnership, close conversations, multiple conversations, we're able to land at this number around 699. And I'm anticipating this number to even go up a little bit more as the hospitals work to create space or bed space within their 4 walls. Okay. So remember the graph earlier? So I overlaid on top of this, we just talked about beds. So the brown curve, this is the hospitalized census. The next lower one is the ICU, and the lowest one is the ventilated census peak. So this is at 40%. Going across, this is the number of hospital beds, the med-surg beds in our system. The red dotted line going across is the ICU beds, and the purple dotted line is the number of ventilators in the system. So the difference that you may see, you've seen 84, 85, and now we're landing on 97. And again, this is on the behalf of the hospitals and to take what we have given them to retrofit or to do preventive maintenance, and this also includes pediatrics. So we're at 97. So what this shows you is that at 40%, we will be exceeding this space right here. We will be exceeding the capacity for hospital beds. However, at 45%, that gap is much reduced. And then at 50%, We are well within our current capacity of beds, ICU beds. However, not so much on the ventilation. So what this means is that we need, as a community, to really be diligent in messaging physical distancing, in adhering to the social distancing orders that have been put into place.
Dr. Dorunosa, Supervisor Hartman has a question.
Yes.
Does this assume then that the current social distancing measures continue through August, September, October?
Yes, it does. And yes, it does. And maybe at a future, update, I can show the models where if you, let's assume that we are at the 50%, and I'm really hoping, and I'm seeing results that indicate we're around 50%. Let's say that right here, we think that we're doing great, and then we let up. There are models that can indicate as you loosen your social distancing guidelines and mandates, the curve does not complete the bell shape going downward, but it actually can go back up. So in terms,
Supervisor Williams.
I guess the question is, how should people envision what 40% versus 55% or 50% is? So you're saying you're estimating that we are achieving 50%. What does that mean? Does that mean that 50% of people are occasionally drifting within 6 feet? Or does that mean that 50% of the people are practicing the guidelines that you issue?
So that's a great question. What we have now in terms of gauge on how successful we've been as a community is really looking at analytics that's available via Google or via a Unicast, I believe, is another. So there are apps out there that are tracking, I believe, based on cell data usage and cell I'm not sure I understand the science behind it, but it's cell usage. And I've been looking at the data, and it looks like we're anywhere between 40 and 60%, depending upon the day. That, given with anecdotal reports from both the sheriff's office as well as my staff who are driving around in the community, looking at restaurants, looking at public spaces, and not seeing the congregations, the masses of people as they typically would on any given day before COVID-19. So earlier I mentioned that that's the lack of preciseness in modeling. We don't have a good hardcore gauge about, is it 50%? Is it 60%? Is it 70%? And how will we know?
Got it.
So we talked about surge planning. So this is I have to say this is my favorite graph because it's simple and it shows the space that we're currently in. So again, the brown is 40%. If we are at 40%, we will look at a peak on June 25th, and this orange salmony space is the 500 bed gap that we had been anticipating, that you'd been hearing for a few weeks now. However, even with a 5% increase, if we follow this brown curve, we are well within our capacity. Our healthcare system may be challenged, but it will not get broken. And then if we go to the 50%, we can handle it within what we currently have. And this is the low blue line is way down here. So you can see visually the effects of social distancing. So with regards to the 40%, for me, for us, our team, that's the worst case scenario. We're at 40%, 40%. So what do we do? So we want to make sure that we can have that capacity, that 500 bed capacity in the worst case scenario. However, before we get there, what we are looking at is an immediate priority to acquire the 20 hotel rooms for the discharged patients meeting the criteria. So these are low acuity patients being discharged. They may not have a home environment that's supportive, or they may not have a congregate setting that's ready to take them back. So by mid-April, we are planning on acquiring 80 additional hotel rooms and building the capacity to stand up 400 additional beds. We currently have the materials for 300. We're acquiring materials to stand up an additional 150. We're looking at various sites throughout the county, and we have begun doing staff recruitment. So even at the 20 hotel bed capacity that we're needing right now, that means intensive staff that's outside of our current response. So that's what we've began to do. We've began recruiting medical professionals and paraprofessionals to assist us in that. Future daily data will guide us. As I mentioned earlier, the more fine-tuned numbers we input into the models, and the modelers are constantly, every 3 or 4 days, fine-tuning their tool as well. So as we progress, I'm anticipating a more precise modeling and more precise results. Our gauge, our lever, is that when we reach 50% of our surge capacity, again, that's when we reach the 699, half of that, so that's 700. So around 350, we will ramp up high gear and stand up what we need to stand up to support our healthcare system and our community. In terms of medical equipment, so currently we have 97 ventilators. As I've shared previously, we have requested an additional 100 from the state. I know that the hospitals are purchasing or pursuing the purchase of vents, and we will continually ask for PPEs from our federal and state stockpile. In addition to that, we are supported by philanthropic partners, and we are able to go out and explore potential vendors who may offer us PPEs. So the takeaways I'd like to share. I've shared with you 2 main models that everyone is using. There's great variations among these 2 models. Again, the models in use give us varied results, ranging from no surge bed need to high need. The Washington model is used by the federal government and provides only national and state level information. The Penn Chime model is recommended by CDPH, and all models really rely on estimated social distancing compliance. I wholeheartedly, from the hard work of all our county partners, all our county teams, believe that we will be ready and prepared. Our models show a range of bed search needs from 0 in the best case scenario to high need in not so good social distancing model. And realistic range is about 40 to 50% of compliance. And this is why everyone needs to adhere, and not only adhere, but really hold each other accountable and share publicly. Social distancing is the key driver in keeping the rates where it's at. Knowing that, again, this is just modeling, we have a phased approach to address any of these scenarios. And we are monitoring the number of hospitalization, the number of cases, the number of availability capacity on a daily basis, and can adjust. Want to point again everyone to our website, publichealthsbc.org, for daily information about the coronavirus, and our community call center at 833-688-5551, as well as our community wellness call center for emotional support at 888-868-1649. 211 is available, and our two reference sites are www.cdc.gov and www.cdph.gov. And that concludes my update for this week.
Thank you very much, Dr. Dermanoso, and please extend our thanks to all your staff. I know everyone is working very, very hard, long hours, 7 days a week, and your effectiveness is really clear and obvious, and these numbers are really encouraging as long as folks continue doing what they need to do. Supervisor Williams and Supervisor Hartman, and any questions from North County?
Yeah, I have a similar takeaway to the chair that this should be should be from the public standpoint an empowering thing to see, that people are making a difference by their level of social distancing, and that if they can keep that level of distancing or improve that level of social distancing, then the community will have the adequate resources to meet the need, and obviously more lives will be saved. I have a part of my district that's way out there in Cuyama, and I just wanted to understand if you or your folks can let us know if local folks believe they have the symptoms and meet one of the tiers in Cuyama. Is there testing available at the little community clinic, or are they counseled to go out to Marion and or other locations in Santa Maria?
So the county does not have a clinic out in Cuyama. It is by Central Coast. So what I would suggest is our system has the ability to do telephone consults as well as telemedicine. So, and I would encourage that community member to tap into that. Cottage has a similar system. I'm not sure about Marion, and if they meet the criteria, the arrangements can be made. So our clinics do offer testing for those that meet the criteria.
Sure, and I know that the clinic isn't a county clinic out there, but it is a clinic, and so essentially they should call public health and not that clinic.
Yes, and I can do follow-up with that particular clinic if you'd like.
Great. That would be wonderful to understand their level of resources.
Supervisor Hartman?
Thank you. I have a number of questions. On the radio today, I heard that there's quite a difference in ethnicity and how the COVID, especially in places like Louisiana. So I just wonder over time if we will keep those statistics as well.
Yes. When I saw the Louisiana, the first thing that came to my mind was also the high prevalence of chronic disease as well in Louisiana. But that is we will be diving deeper into our number of cases as well as our hospitalizations to see if we can spot any trends. With that, the goal is really to how do we step up or focus our prevention and intervention efforts from a policy level, from a clinical level, from a health education level in communities that might need that extra attention. So that's why we will be looking at all of our numbers.
Thank you. I have a few more questions. So basically, we have to have the beds, we need to have the personnel, and then we need to have the equipment. It sounds like we're planning, of course, for all three, and that the equipment, the ventilators, are the limiting factor. But if we can flatten the curve, more will be produced and available. But we're looking largely at our county and in isolation from how other counties throughout our country will be affected and how resources may be moved around. So as the models get better, I guess that's something to be thinking about. How does our curve relate to other curves and resources?
That's a great comment. So I wonder as well, as in particular, I'm curious about how SLO's doing or how Ventura County is doing. And so those are our two closest allies. And I have seen Ventura County's projections, and they're very similar to ours.
And then, I mean, we're trying to flatten the curve, so we might get more testing. We might find out who's immune. We might have some actual treatment. I mean, I think you're giving us the model, but we're thinking about up here social distancing through September, October, and how really difficult that would be. So I think we're kind of waiting for a breakthrough, and you're just giving us a model to how do you plan for healthcare beds and personnel and equipment.
Right.
But how we plan for the rest of it is a really big question. Thank you.
Yes.
Are there questions from Santa Maria?
Yeah, I got a couple. Dr. Donoso, do you expect to maintain the level of social distancing that we're talking about here in these graphs as long as the graph goes out to November?
Personally, I know that I struggle with it. I have a family that struggles with it, so I fully understand how difficult it may be, especially for members of our community who live in a high-density situation. However, I'm also seeing, what worries me is seeing where there is no social distancing and the impact it has on the community in terms of severe hospitalizations, deaths, and a healthcare system that is so overwhelmed that that healthy people are also affected. So do I think that, is it sustainable all the way out to November? I'm not sure. I think that it's a conversation that needs to happen in a variety of contexts and in a variety of settings so that we as a community can land on a solution that is doable, that protects the vulnerable members of our community as well as safeguarding our healthcare system.
Well, that's interesting that you say that, because I get the general sense here that there's two competing overarching strategy considerations. One is the deaths and the illnesses, and the other is economic. And the economic impacts of this are getting overwhelmed by the physical or the health impacts at this point. But I'll tell you, if we go on until November 1, you just said it yourself, there's people that are going to be injured that don't get sick. And, I don't think we're balancing the needs of those people that are trying to make a living out there very well. We're seems like we're over focused, and maybe rightly so. And I don't want to act like I have any answers, because I don't. But I just know that there's a tremendous amount of pain being loaded into the system at this time, and it's largely undetectable because everybody's sequestered in their own homes and out there in their essential businesses and stuff, and other than that, there's not much going on. And obviously, it's very difficult for people to come and give us public comment and stuff, and I suspect if it were easier, we'd be hearing more. And I think as time goes on, this is going to start wearing on people more and more, and I think we're going to be subject to a lot more demands to lift these social distancing guidelines and try to find the people who are at the highest risk and try to protect them rather than getting everybody, we're kind of throwing the baby out with the bathwater at this point, and I think that the damage is going to be really deep if we try and go until November doing the same thing we're doing now. I mean, I think that, we should start those discussions sooner than later until we just sort of run it to failure or rebellion or whatever. At some point people are going to stop cooperating, and I don't think it's going to last till November. And then, if we get to the point where, we have to start arresting people and, it's not America. And I realize these are extraordinary circumstances and you can keep this up for a while, but, when you start showing people charts like this, that, under the best case scenario, we don't even get down to zero again till after November 1, and that's with 50% social distancing, which we're assuming we're doing now. That's not very encouraging to me, from an economic perspective of the whole community here.
Supervisor Lavanite.
Thank you. I have a question about slide 10. It's the U of W implications for Santa Barbara County. My question was just on the ratios. We show that our projection would be like 140 in the census for the hospital with ICUs at 21. So I'm just trying to figure out how that correlates to like what we have right now, where the ratio seems to be a lot higher, where we only have 34 hospitalized, but 19 are in the ICU. So I'm curious how our ICU numbers look like they'll get significantly better, even as we get more patients.
Right. So I would, I'm sorry. Let me go on to slide. Right. So the University of Washington model, again, is it's a national model, and it's for states, and the preciseness is difficult because we are one huge state with 58 very diverse counties. So when they lump it all, the 58 counties, into the California model, it isn't precise when we extrapolate it purely using a percentage of population. So that's why it is a model that is frequently used by the states as well as our federal government. So I thought I would put it in there.
Okay, thank you.
I had a question about the percentage of hospital beds that are being reserved for regular hospital patients, that is being held as a 40% reserve capacity, and I think that makes sense. That's a very conservative, smart thing to do. But I'm wondering if that is the experience that we're having in the hospitals. It seems like anecdotally around the country, as people are staying at home, that there is much less demand for hospital beds.
The 40% number we landed based upon our conversations with all of our hospital partners. And again, when we were able to get their licensed beds and their surge capacity, the big question was, but how much do you need to set aside for day-to-day normal healthcare needs? And we all agreed on the 40%. So it was validated by the hospitals.
Okay. And then you did, at the beginning of your presentation, have a number of caveats about the reliability and the predictability and the precision of the model as time goes on. You mentioned that there's more confidence in a shorter horizon of predictability. So, and that these models are being refined all the time, and new data is coming into the equation, and we're in real time integrating that information. So it's probably premature to be talking about September and October and November. We're trying to concentrate on people today, what they're doing now, and from the information that you have, which is proxy information. It isn't precise. It is the cell phone data, as you mentioned, primarily from Google and Unicast, that tells the relative amount of distance that has been reduced, traveling distance. It doesn't speak to how close people are together, whether they're adhering to a 6-foot social distancing practice. But it's a tool, and it's the only tool that we have. And it's encouraging, and it's telling us that we're doing a good job, and that every 5% additional effectiveness in social distancing has a huge impact on flattening the curve. So I think that is really the most important message I heard today, is that social distancing works, and it can work even better if we do a little bit better job. Everybody individually doing a little bit more can make a huge difference on the impacts of the capacity of the medical system to absorb patients. Is that all?
Yes, so very aptly summarized, thank you. My only addition to that would be, yes, these models are tools. And what I'm seeing is that the next 8 to 10 days will tell us a lot about what we need to do differently in terms of modeling and in terms of planning.
And I know another tool that you are looking at is the practical real-life experience that's happening in the Bay Area. They're ahead of us, and we're seeing in real time what it is that they're experiencing, and the early indications are that experience is consistent with what you're seeing with the modeling and the effectiveness of social distancing. So that's another data point that is encouraging and gives us insight into what we might be looking at in the future.
Yes.
Okay.
So maybe we'll bring that slide at our next update.
Thank you. Supervisor Williams and then Supervisor Hartman.
Well, I agree that it's premature to talk about November, and that the most important information that these models reveal is what a huge difference can take place between different levels of social distancing. However, I do think Supervisor Adam is right that it's at some level it is a policy question of because destroying an economy kills people too. It does. So at some level you have to work out as a policy matter where to balance this. And it is not just a realm for public health, it is a realm for the people that the voters elect. So I do think it is important to have that discussion at some point. My view is that if workplaces were properly equipped, if preparation were made, that more people could go back to work while maintaining a certain amount of social distancing. And that, of course, would be an important job for public health to advise employers on how that would make, and obviously that has to do with a policy call by the state as well, since we are in their shelter-in-place order. But, you know, it is a fact that economic collapse and poverty also kills people. So there is a question, an outstanding question of how long you could close most businesses. You know, I think we can do it for longer. I think we should do it for longer. But the question is how long you can do it without hurting a whole lot of people. And I don't mean hurting people like making them lose a little bit of their income. I mean hurting people as in ruining their lives.
Supervisor Hartman.
Well, I have 2 points, I think. The first is we do now have an additional social distancing recommendation, and that is face covering. And I commend my fellow Supervisor Williams and Yaash for showing us, as well as some people in the public today. But I think that is saying, I'm a good citizen, I'm here, I'm wearing my face covering so that I can protect other people. And so when I'm out in public, I've started to do that, and I understand we didn't do that initially because we didn't want people to be confused with medical masks and take resources away from our medical personnel, but that's a beautiful color, Supervisor Williams, and we're seeing more and more of those. So I know it's for our culture, it's a difficult thing for many people, but we have to make this something that is socially commended, because it is an additional strategy that may bring that curve down faster. So that's one point. The second point is, I think we're holding on for more testing and ultimately being able to see who's immune, who can go back to work safely without getting sick. I know we have a 3-tier testing strategy. Could you comment on the supplies for testing and where you see that going in our county?
Sure. So the supply for testing, we do not have an issue with testing anyone who needs to be tested on Tier 1. However, I do understand that there are Tier 2, we are beginning to do Tier 2, and I know that there are members of our community in Tier 3 that would like to be tested. So the only thing about the testing that I worry about is that when you get the test and you get the results that's negative, that doesn't mean that tomorrow you won't be exposed or the next day. So we are really sticking to our message that social distancing, good hand hygiene, and being self-isolating, all of that, face mask, face coverings, all of those will really be more protective than taking a test when you are not symptomatic. On the flip side, with regards to what our efforts, so I mentioned, I think it's been maybe 3 weeks now that we were in pursuit of a rapid testing, and our lab director excitedly told me yesterday that he has a FedEx tracking number. So we are getting 200 rapid tests in the public health department to be able to do Tier 1 quicker turnaround times. I think that as a community, the healthcare system, the hospitals, as well as the outpatient clinics have also have an increased capacity to test. And then on the back end, with the commercial labs being able to run a higher volume of tests, means that we're getting quicker turnaround times for the testing. And I know that our previous health officer, Dr. Charity Dean, is leading a task force up in Sacramento for serology testing. So for people to be able to identify if they had been exposed to coronavirus. While there's still issues around that, the lack of specificity, coronavirus as a family versus COVID, that is something that we are engaged in the daily calls and seeing how can we position ourselves to be in the waiting line to get access to those as well.
And one more. I mean, I think what we're trying to do is get through the surge and keep it within our capacity to handle. And then we started out trying to trace, I forget what the medical term is, but
Contact tracing?
Contact tracing. And now we're in the mitigation phase, but if we can reduce the number, then we could get back to that tracing strategy if we knew who had it, who was immune, if we had better testing. And I think that's one way we could progress and get ourselves out of this. But it may be, as Chair Hart suggested, premature. We do have our budget workshops coming up, and that'll certainly be an opportunity to talk about some of these things. But maybe after our surge or high point, we really need to think about what are strategies to manage the disease and get as many people back working as possible.
So while we are not doing contact tracing for the general public, for those who are in congregate settings, your skilled nursing facilities, your assisted living, your law enforcement, all of that, as well as essential county services, and I believe, have extended to cities as well. So we're still doing contact tracing in those unique circumstances so that we can protect the rest of the essential workforce.
I see that Mr. Chapchin is here as well. Would you mind telling us more about what's going on in regards to serving our unhoused population during the COVID pandemic? Thank you. Yes, that'd be perfect. Let me see. I don't think I have you. There you go.
Absolutely. Thank you, Chair Hart and supervisors. I've been at the EOC for the last 2 weeks, I think, in charge of the operations section, and they're taking on a number of approaches to this, and one of them is the shelter operations. About 2.5 weeks ago, I think the county opened up a shelter in Santa Maria, only because the providers in that area couldn't do it at the time. They were short on staff. So we picked up the slack, opened up the shelter. It was really challenging, but we were serving a maximum of 71 people up there. So on a bad night where it was raining at 71, on a good night it was between 50 and 60 people that we were serving. The challenge has been staffing it, of course, just like the nonprofits. Just this Monday, Good Sam stepped up. They had hired additional staff, they trained the staff, and they stepped up and they took over the operation of the shelter in Santa Maria. Now we're also supporting them with food, security, laundry services, and cleaning services in the meantime as they're transitioning, but they hope to at some point take on those tasks as well. United Way in North County has an outreach team. They're stepping up their outreach efforts. We help pay for a portable shower for them, so they're looking at sites, 3-4 different sites to take the shower. They're not operational yet, but they hope to be operational in the next 5 to 10 days. They do have the unit. They're just trying to get staffed up and find the appropriate shelters. We are looking at shelters down here in South County and in Mid County. It's been a challenge. We've looked at several sites. We don't quite have the partnerships we hope we would have. We looked at a site in Santa Barbara yesterday. We're looking at a site in Goleta and several other sites that we can open up as shelters. But again, we need a partner to shelter up. And PATH has been, it's been encouraging to talk to PATH. I think they will step up and help us with that shelter. So we're in the process of looking for shelters now. In the meantime, we're providing food through the food bank to folks, and essential services, supportive services. Be Well staff has been out there at the shelters, as has probation staff. So the full array of services that we can provide have been provided. But we're actively looking for hotels to hotel people who may be at high risk. And we're looking at, just yet today I think we'll be talking to the Ramada Inn by the county campus and some other hotels we've talked to, the Motel 6. It's just getting that contract in place and looking for staff. Again, staffing is just hard. That's the key. I think we'll be able to get the sites. It's finding the staff. People, of course, are afraid. And most of the volunteer staff that shelters have been older people, so they aren't stepping up.
And the funding that the county is using is the HAP and the HEAP funds.
We're using HEAP and HAP funds. We're going to exhaust those first, but I think those are reimbursable by FEMA, and I think Kelly can talk to that. But everything is being traced. Everything, everyone's putting their time cards in, coding it to COVID-19. Everything that we do spend is being traced, and the auditor's teams are on it. So we should be able to get reimbursed at least for 75%. And if the state declares this the emergency as well, we can get 75% of our 25%.
And I know that you had 8 staff working 10, 12 hours a day, 7 days a week.
I have to tell you, Supervisor, it's been tremendous out there. It's frustrating, but they are at it. I think we spent about 50, 60 hours a day just looking for staff and working on the homeless shelter issue. I think it's been the primary goal at this point. Some of the other issues have been kind of put on the sideline. We were also looking at the senior population and helping the senior population as well with housing and services. But the homeless issue has been, the top priority.
And it's a complex issue in the sense that, we have a pandemic. This isn't the normal time when we'd be trying to stand up a shelter to take care of people and all of their needs. It's a combination of doing that and at the same time providing a safe environment in a congregate setting that wouldn't create a hot spot for the transmission of COVID-19. And there is an absolute real-life balance point between bringing people together in a shelter and having that potential versus them being out in the community, living in encampments and having that same potential. And, so far we have been lucky and fortuitous that we haven't had issues in either place, but it's not as simple as let's just bring everybody together. There are real issues with that, and there are differences of view. I know some of the medical community are very strongly concerned about the idea of bringing together folks in shelters. Other folks who are, fierce and passionate advocates for helping the homeless, want us to do more in that regard. And you're trying to balance those realities and find the service level and the appropriate facilities that make this work for everybody.
You're absolutely correct, Chair Hart. It is difficult, and the goal of the task force is to reduce the spread of the COVID-19 among the homeless and among the general population. But we're seeing that if they aren't in the shelters, apparently law enforcement is seeing more encampments together, so we want to try to keep them apart if we can. So the goal is really to get them in a shelter or in their separate housing if we can for the vulnerable population. But it's very complex, and we sit there and we talk about, let's get a hotel. Well, wait a minute, this is a population that may not stay there. There's some other issues, cleaning, housekeeping, the hotel doesn't want to do. So we have to step up and try to find those as well. So it's complicated. Even the shelters, keeping them apart. Some of the activities aren't, if you or I were in a shelter, it wouldn't be the same as some of this population. But it's complicated.
And the outreach workers are going out in the community, providing education about COVID, directing people to services, the showers, the other hand washing facilities, trying to make sure folks have as much information as possible who are unhoused and not in shelters or hotel rooms at this point.
Absolutely, yes. Showers of Blessing has gone out. They've restarted again. They have 5 sites that they go to. We're helping with meals out there. United Way's outreach team is also going out, and they're providing meals on site to folks who may not be in the shelters. And we also have a hygiene kit that we're providing United Way and some of the outreach teams so they can give the homeless population some hygiene kits as well.
And as we get more masks, I'm sure we're going to be distributing those to folks as well too.
Yes, yeah, that's another challenge also for the service providers is they need masks because I think their staff still doesn't feel safe. And I don't know how safe those masks are. I think the N95s are the most effective, but anything is better than nothing, I think, at this point.
Thank you. And then, Ms. Hubbard, did you want to say something about the FEMA reimbursement?
Yeah, just our understanding or what we're hoping to get from FEMA is that FEMA would cover the 75% of eligible costs, and the HEAP and HAP could be used as our local match. That hasn't been confirmed. We're still working to try to see if we can get clarity on that, but that is our goal in that funding. And then just so everyone's aware, CDAA, the California Disaster Assistance Act, hasn't been approved at this time, so it would be it's a 75% FEMA, 25% local government of eligible costs, and again, hoping to get that HEAP and HAP as part of that local match. And all of the volunteer hours and staff hours also contribute to that local match.
And by that strategy, we would potentially preserve the HEAP and HAP funds for the long-term projects that we had hoped to be doing prior to the COVID crisis and have those refunded through the reimbursement process from FEMA. Okay, smart strategy.
Okay.
Supervisor Hartman and then Supervisor Williams.
Yes, just a quick question. A number of people have suggested remote locations for serving those without homes. And I assume it has to be central just for all the services that need to come in. Is that correct?
You're correct, Chair Hart, through the Supervisor Hartman through the chair. It is correct. They do want to be in the community that they are in. You know, we thought about one centralized location, but people in Santa Maria, some have jobs, some are in construction who don't have a place to live. Their service providers are down here. The hospitals track them. They have caseworkers. So they need to be near their caseworkers. You know, the hospital's not going to bring a caseworker all the way down to Santa Barbara if we had one site. So those are complexities as well. We do need different sites, and we can't just centralize them in one location.
And final quick question. Is there any silver lining here? Are we getting wraparound services to some of these people and helping them find ways out? Are they part of our coordinated data entry system in this process?
Yes, they are all part of the HMIS system, so we have data on everyone, and the wraparound services are still there. So it's all part of that system.
Supervisor Williams.
Well, I just want to encourage you that either a decentralized or some facilities are better than none. I obviously have concerns about a large number of people in one location, so I do think that there is some merit to pursuing more than one strategy. But you know, some facility is better than none. So I hope and encourage your conversations with PATH or whatever other service provider steps up. And then I just wanted to, you know, give a little bit of lightness to this face shield and mask question, which is to publicly say I was wrong. I went with the CDC recommendation and had a quite spirited discussion with my mother. And apparently, my mother knew better than the CDC and the President of the United States and insisted that it was the right way to go, and the CDC changed its recommendation. So I want to publicly acknowledge to the whole world that I was wrong and my mom was right.
Supervisor Hartman, do you have another question?
Oh, I just had one comment. I heard on the radio today that the New Zealand Prime Minister has declared that the Tooth Fairy and the Easter Bunny are essential workers. And Ya'ash may want to know about that.
That's a nice little lightening of the moment from both of you. Thank you.
And Chair Hart, if I can add one more thing, the HEAP funds, there's a time limit on those. So with the cities, they can use their HEAP funds for this, so that they don't run out of the time. So
Thank
it's
you.
available.
Appreciate that. And then any questions from Santa Maria, my colleagues? And
We don't seem to have any questions at the moment. Thank you.
okay, thank you. We have public comment. I think we have a number of people who would like to speak on this item. Madam
Yes.
Clerk?
Chair Hart and members of the board, we have 5 requests to speak on this item. We have 2 letters to be read into the record, and then we will have 3 requests to provide comment over the phone, to begin with Dr. Tom Hasia, to be followed by Anna Marie Gott. I will go ahead and read the first letter into the record from Corey Heyman. Dear members of the Board of Supervisors, I have 3 comments for today's hearing. First, I would like to acknowledge the continuing improvement in the County Health Department's public reporting of daily statistics on COVID-19. Thank you. Second, on behalf of myself and many other community members, I would like to express our great appreciation for allowing the beaches and trailheads to remain open. By and large, the people of Santa Barbara have demonstrated care and diligence in social distancing while spending time in our public open spaces. I applaud your faith in our community's ability to act responsibly. Finally, there have been recent reports on the actual trajectory of COVID-19 in our state and county. I encourage the board and staff to pay particular close attention to the numbers. If the trend line continues to be positive, I respectfully request that the board and staff be proactive in identifying the next steps for our county. Thank you for your consideration, Corey Heyman.
Thank you, Ms. Heyman.
And our next letter to be read into the record is from Jose A. Navarrete, a resident from Solvang. Good morning, honorable supervisors. I find it troubling that better care is not taken to translate the materials on the county public health website into Spanish. It is currently in Google Translate mode and makes no sense. While I understand this is only temporary, the prospects don't look good, and honestly, it's been nearly a month already. You see, there is a group of us local court-certified interpreters, translators, public servants, and officers of the state judiciary who offered to help for free when this crisis began taking shape last month, trying to do our part as a valuable resource to the community. We have been met with disdain and indifference. Sadly, county officials decide to use bilingual staffers to translate their materials, which leave much to be desired, at best, lackluster, at worst, nonsensical. You should be relying on true language professionals actually trained and experienced as full-time linguists. Would you think of hiring people as doctors and nurses who do not possess a medical license? There is no difference here. The public deserves better. Contrary to the belief of these bilingual staffers and those that enable them, the Mexicans and other Spanish speakers in our communities are not subliterate. It is irresponsible, offensive, and disingenuous to justify these shabby translations by claiming to target folks who won't understand their own language. Please reconsider your language access strategy. Otherwise, I thank everyone in the county for doing their part in keeping us all safe. Please let us do what we do best. We're here for you and all.
I think that bears a response from Ms. Nisich, because I think there's some factually incorrect assertions in that comment.
Good morning, Chair Hart, members of the board. Yes, I would like to address that. In terms of our actual website, we do have it translated. The components of it that are still in Google Translate mode are those primary components that are translating directly from the CDC website and the CDPH website. We do translate all of the information that the county pulls for specific local information. We translate all of that. We do have individuals currently within the JIC represented from our court system who have approached us. So we do have our certified court translators as part of our joint information system or joint information center. In addition to that, we do have individuals within the JIC that have also taken extensive FEMA translating services or training. So they have that level of translation. In addition, our lead PIO, Jackie Ruiz, is a certified Spanish translator as well. Our process for doing Spanish translation does not differ from us presenting everything in the English language. Our process is that every document receives two sets of eyes. So if we are putting out something in English, it is looked at for consistency. If we are putting out something in Spanish, it is looked at for consistency. So there often is a different interpretation sometimes, and then we take that to our lead PIO. So we're very conscientious about that. We do have a disclaimer on our website letting folks know when they do hit that button that we are oftentimes in the process of translating, and we work to get everything up real time. In addition, I will say that because there is so much information that was coming out over the weekend due to be set up for this week, we had a number of our translators working over the weekend, so English and Spanish could be posted at the same time. We do have a cadre of, I believe, about 11 translators, and at any one time, about 3 of them are working virtually within our Joint Information Center. I hope that answers your question.
Thank you, Ms. Nisich. Supervisor Hartman?
Yes, if I understood, you said that we use Google still for the state and federal, and the state at least doesn't have Spanish?
CDPH is done through Google Translate. Yes, ma'am. If you go to the CDPH website, there is a button that will translate the bulk of their narrative. They have a very high narrative content on theirs. However, I will also say, and I should have mentioned earlier, in order to help individuals get more direct information from both CDPH, our website, and CDC, we did post a link to the resource page. So that is a page wherein information, and specifically infographics, you see a lot of infographics with this event. Infographics are, if you go to that resource page, and it's a pull down from our website, If you go to the resource page and pull down and look at CDPH and CDC, you will also see that we've linked to all the infographics, which can be seen in English, Spanish, as well as I believe up to 10 other languages. So that is a real-time ready resource from CDPH and CDC where you can get all of that information bundled in one location, in addition to everything else that is on the remainder of the website. So that is the part that's translated from them.
Thank you, Ms. Nisich. And while you're here, why don't you also add information about the additional Spanish outreach that has been going on, the work particularly to the Mixteca and the Oaxacan communities in North County?
Yes, I'd be happy to. We've done a series, the Joint Information Center, working with our community partners and a number of individuals, I can't even list them all, have been working on a number of outreach messages to the Mixteco and the Oaxacan population, specifically a number, I believe, as of count yesterday, 10 individual videos have been produced, and all of those have also been converted to PSAs on the radio stations, both north and south. So we've targeted very, very specific stations. In addition, we've also been working with our promotoras. We've been working with First Five. Dr. De Reynoso has been working with her outreach teams. So we've been doing quite a bit of work in those areas as well. And we're really focusing on the Spanish radio stations through the PSAs, and we're getting additional signage up throughout key neighborhoods as well.
And that will increase and only get better as time goes on.
Absolutely.
Thank you very much. Our next public comment?
Yes, Chair Hart, members of the board, we will now go to our 3 requests to provide comment over the phone. We will begin with Dr. Tom Shaw, to be followed by Anna Marie Gott, and our final speaker is Andy Caldwell.
Hello? Hello?
Yes, we can hear you. Please
Can
go
you hear
ahead.
me?
Yes, we
Chair
can.
Hart, members of the board? Can you hear me?
Yes, we can hear you.
Great. Wait, thank you so much. Chair Hart, members of the board, thank you for giving me this time to speak. I want to introduce myself. I'm Tom Shaw. I'm a physician in Santa Maria with training in internal medicine gastroenterology. And I've been a gastroenterologist in Santa Maria for the last 26 years. And I'm just coming here as a concerned physician on behalf of all my patients and as a concerned citizen on behalf of my friends and neighbors in Santa Barbara County. My proposal is that the shelter-in-place order by the governor, I think, was a very good first step in flattening the curve for the state at large in terms of the viral infection. But unfortunately, as you can see from some of the graphs I forwarded to Chair Hart, the curve for Santa Barbara County is not flattening as well as we like, and I think we need to do more. My proposal of doing more is by mandating a proposal that is similar to the face mask order that it was enacted by San Diego County, just I believe as of Monday. And I think it's consistent with some of the best practices of some of the countries in the world that have the best, have been performing the best in terms of controlling this virus. I was just wondering what your thoughts are, Chair Hart or members of the board. Were you able to review some of the notes, some of the emails I forwarded to you?
Dr. Shaw, we don't do a dialogue at public comment, but you have communicated, I think, to all of us about these items, and we'll respond in a different format, in a different forum. Thank you, though.
Sure. Thank you so much.
Thank you for commenting.
Thank you.
Supervisor Hartman?
I just wanted to ask, we're doing daily press conferences, and will these models and all be discussed sometime this week?
Yes, we are continuing with the press conferences, and we have demonstrated some models, and we've even made videos of face covering. I want to really make a clear distinction between masking and face covering. We really want to reserve the N95s and surgical masks for our healthcare workers. So for everyone else, we're talking about face covering. Yes, and that is a message that I believe yesterday Supervisor Hart demoed his, and we will continue to do that to routinely remind everyone.
Thank you. We have additional public comment?
Yes, Chair Hart, members of the board, we will now go to Anna Marie Gott on the phone, to be followed by Andy Caldwell.
Good morning. My name is Anna Marie Gott, and I just wanted to make a few comments, not just about the county, but also about the city of Santa Barbara and the reports that are being presented on a daily basis for the news conference. I'd like to recommend that for the daily news conference, that you actually put the percentage of people that you believe are social distancing. I know that you believe right now that it's 50%, and how that data was derived from, or where it was derived from. I think if individuals had access to a link where they could actually see that information on a daily basis, that might be helpful. I'd also like to just mention that we are not seeing any demographic information regarding race in any of the data that's been provided on a daily basis, and I think that would be very educational for individuals. I've personally witnessed in the city of Santa Barbara numerous parties and barbecues and a lot of issues with social distancing between certain ethnic groups, and I believe that a lot of information is not necessarily being distributed to certain populations. And it's very concerning, especially as some populations there's going to be more density in homes. And of course, we already know that density actually increases the spread of the disease. The other thing that I would also like to just comment on is social distancing and enforcement. In the city of Santa Barbara this weekend, I witnessed patios that were filled with people eating at restaurants. I also saw a number of barber shops and salons opened, and gym equipment used in our parks. And I'm just curious to find out, what is the county's policy regarding police officers or county employees? If they see something, are they supposed to do something? Because I think that is really one of the only ways that we're going to be able to stop the spread, especially in some of these businesses that are supposed to be closed down, or actually not having patio service, basically out in front of their restaurant. And when I mean patio service, I don't mean that they are serving individuals in the patio. I mean that the customers are purchasing food, and then they are choosing to sit in the patio to have their lunch or their dinner or their breakfast. And that's very disconcerting to actually look at, especially when it can be viewed from the street. And you know that police officers, as well as city or county employees or even council members, have driven down Milpas or State Street, and they've all witnessed it. All they had to do was look to their right or to their left, and they could see all of this occurring on a daily basis.
Thank you, Ms. Scott. Your time is up.
Is regarding
Ms. Scott,
the recommendation of the county that
you have
everyone
gone
that is going to be
beyond your 3
outdoors
minutes,
is going
Ms.
to be
Scott.
wearing a mask. We're already hearing about grocery
Thank
workers
you for
that are
commenting.
actually dying, and that's obviously a disadvantage. A lot of
Ms. Scott?
There you go. Thank you.
Ms. Scott, hi, the chair is just telling you that your time is up, and thank you for your comments. Thank you. Bye-bye. Chair Hart, members of the board, we will now go to our final speaker, Andy Caldwell.
members of the board. Andy Caldwell representing CoLab. First off, I've been sending you guys, all the board members, articles for almost a month now from leading epidemiologists and data analysts from institutions such as Stanford, MIT, Harvard, and the like, that for weeks have said that the number of the infection rate, hospitalization rate, and all that has been severely overestimated. Well, just 2 days ago, the two doctors of the United States that have been at the lead of this, Dr. Fauci and Dr. Birx, and who have been relying on this IHME model, it was cut by 46%. 46% on average. And I don't see that. I think your health director glossed over that. And here's the point. The charts, we've been asking for information and data on these charts for weeks. Well, they finally did it, but she started on April 1st. All of your charts have an April 1st start date. This pandemic didn't start on April 1st. California had its first recorded case back in January. Why isn't she showing you, instead of showing you future projections, why isn't she showing you actual data in time from the first diagnosed case in Santa Barbara County in terms of hospitalization, ICU, and the like? Supervisor Williams, you were completely right on, and Supervisor Adam, your job is to go ahead and let the health director prepare for the worst, but your job, starting a couple of weeks ago, was to balance that information, but you're not including any balanced information in these presentations. Brian Gable is somebody that I had on my show. He's a data analyst. He sent you data that shows that he believes that we already peaked in Santa Barbara County. We have already peaked. And in fact, people are believing now that New York has already peaked. And again, this information isn't in there. Their projections are off by orders of magnitude. There is no reason to believe we can't social distance at work. Why don't you treat your constituents as responsible adults? Finally, I sent you an article from the Los Angeles Times that Governor Newsom's administration has ordered positive COVID-19 diagnosed patients into nursing homes. That right there is a death sentence. You want to talk about something that's going to spike the numbers, send positive people into nursing homes where you have the highest vulnerable populations at risk. There's another issue, plastic bags.
Mr. Caldwell, your time is up too.
7 years ago and published an article that viruses can go into reusable bags. Nevertheless, you ban plastic bags. Well, now stores are banning reusable bags.
Thank you, Mr. Caldwell.
On that?
Thank you very much.
The bottom line here is we cannot withstand this going into July, let alone November. I don't think we're going to make it to May. And I think it's time for you to start balancing things and to pressure the governor to look at the projection,
Mr. Caldwell,
the number of infection and the infection rate, and let's get honest numbers from day one.
Thank you, Mr. Caldwell. Sorry that your time is up, but 3 minutes goes fast. All right.
Chair Hart,
Yes, Supervisor Adam.
if I could provide maybe a little perspective, I do have another question for Dr. Del Reynoso. Doctor, I assume you're still there.
Yes, I'm here.
This isn't, do you agree with me that this isn't going to go away even after November?
That the coronavirus or the COVID-19 virus, it will not go away? Is that your...
Correct.
As a virus, I believe that it will be present in our community. Yes. In this form, I'm not sure. Mutated, perhaps.
Well, let's hope it doesn't mutate to its own benefit. But for the purposes of this discussion, it just stays the same. So in terms of just kind of perspective and calibration for all of us, so that if it's not going to go away, the future of every person on this planet, at least to the point of herd immunity, includes either effective vaccination or survival of the disease, right?
Correct.
Okay. So I think what we need to do is think about this for a while. I think as Supervisor Williams was talking about earlier, having a discussion, and I don't think it's an appropriate time to do it now, but we need to do it soon, and I think we all need to talk to people that we rely on. I know all of us have people that we rely on to advise us on these type of matters, because none of us is an expert in this stuff, but we are nevertheless elected officials, and we do need to balance those needs, as Supervisor Williams was talking about earlier. So we need to have this discussion of surge management, as Supervisor Hartman put it, and then the post-surge management. You know, the surge management, I get the strategy for surge management, but it's almost like it's become like a permanent condition, and you know, I don't think it's sustainable, and I think we need to start thinking at this point of a time sooner than later when we start relaxing the surge management strategy and enter into more of a long-term, given the fact that we're either going to have to, we're going to have to achieve herd immunity one way or another, either through vaccination or survival. And, you know, I think people have in their terror, you know, some people are in full-on terrors about this, which is explainable, expectable, understandable. I get it. If you're a person who's feeling vulnerable to this disease, but you know, I think for policy's sake, we need to understand there has to be a recognition that we're part of nature, and we're not going to escape, you know, the biological need to attain some type of a resistance to this disease, because it's always going to be with us from now on, and we'll be lucky to some extent if it doesn't mutate to its own benefit and become even more effective at moving from person to person, or any other method of perpetuating itself, which you know, that's what it's doing. It's just perpetuating itself. And so I think we need to have a discussion here, and after we have that discussion, we need to be able to contact the governor, because, you know, all of this policy, almost all of this policy emanates from the state at this point. There's some policy that seems to be trickling out of Washington, but the state seems to be where our public health takes the lead on, and I look forward to having this discussion sooner than later.
All right, are there any other comments or questions from the board? I think it is important to recognize that we are in the middle of a public health crisis, and that the direction and the advice of the medical professionals remains the same: to social distance, stay home, If you must go out, limit your trips out. If you go out, use a mask to protect others. You may be asymptomatic, but have the virus and could be spreading it. Don't touch your face if you possibly can. Wash your hands regularly, disinfect surfaces. And if you are feeling sick, isolate yourself at home and contact your medical professional and seek additional advice if your symptoms worsen. They're simple steps, they're important steps. They're working to stop this virus, and I think today's presentation was a great opportunity to see in a physical way, visual way, the results of the differences in the effectiveness of social modeling on the ability to flatten the curve and preserve the medical system that we need to be available for patients. So,
Chair Hart?
Yes, Supervisor Lavanino?
I think it's a good time for me to comment also on the job that you're doing representing us as board members. I know it's not easy. You have the 4:30 daily press conference, and you probably got sworn in as chair not knowing that you were going to be called upon so much, but I just appreciate the time and the energy and the focus that you've displayed and the calm manner in which you're trying to get out public health messaging. So I just appreciate it, and I know my other board members feel the same way.
Thank you, Supervisor
Amen.
Lavanino. And
Amen.
I just want to say that I am continuously amazed and impressed by the professionalism and the commitment of every person in the county team that is working day and night, and all of the people in the medical profession in our community, who are on the front line of this, the first responders who are the very first people to roll when they get a call on 911 to go to a patient who is in danger. And we are all trying to do the best we can with not enough information and not enough resources, but the response from the community in particular to the recommendations that we're hearing is astounding and really heart-affirming. And if we continue to be together as a community, trusting each other, working with each other, being kind to each other, we're going to prevail through this. And then we'll be able to have conversations about the future in the future. So thank you for that.
And
yes.
I had to add, Supervisor Lavanino, you don't see the county leaders out here in the room, but it has been a month, and I see some tired eyes, and I hope people will be taking care of themselves, and anything we can do as a board to support you, we want to do it, because this is a long haul.
Thank you. Well, that concludes we need a motion. Would someone like to make a motion?
I move that we accept the report.
Thank you. Motion's been made. Is there a second?
Second.
Second.
Any discussion? Roll call vote, please.
Mr. Lavanino?
Aye.
Mr. Williams?
Aye.
Ms. Hartman?
Aye.
Mr. Adam?
Aye.
Chair Hart?
Aye.
Motion passes unanimously.
Thank you all for being here today. CEO Miyasato?
Chair Hart, thank you. We wanted to just go back to the administrative agenda, and the clerk has it on A5. It was read as we corrected the record to say it was a majority vote. That was really returning to A6. So A5 is a 4/5 vote. You did vote 5-0 on the administrative agenda, so it doesn't matter, but we wanted to clarify the record that item A5 did require a 4/5 vote, and that is how the board voted.
Thank you for that clarification. Let's move on to Department Item 2. Could the clerk please read the item into the record?
Chair Hart, members of the board, departmental item number 2 is from Public Health. It is a hearing to consider recommendations regarding a waiver of retirement exclusion for Catherine Macy for the Santa Barbara County Public Health Department, PhD, Fiscal Services Program.
Good morning.
Welcome back.
Yes, Public Health is here to ask that your board allow us to bring back a retiree Kay has extensive knowledge of our federal HRSA grants, which funds our clinic system, and has been the focus of the federal stimulus bills, at least 2 out of the 3. Kay's expertise in the ability to access those funds for partial recovery of impacts to our healthcare centers is critical. In addition, our cross-training efforts were interrupted, and the extra time will allow us to transition her duties to other members of our team.
Thank you. Mr. Gazzani?
Chair and Supervisors, this is reminiscent of an item that my department brought about a week ago. I'll just repeat that beginning in January 2013, the California Government Code placed restrictions on public agency retirees being rehired within 6 months of their retirement. Those restrictions are laid out in this board agenda letter. What's also occurred is that Governor Newsom's Executive Order N35 on March 21st suspended those particular government code provisions about work hour limitations and time limitations that otherwise would apply to recent retirees of local agencies such as the county. So after the board is done with this item, the CEO and the board will have some policy choices about how to filter these and whether they will go to the board in the future or not.
Thank you for that clarification. CEO Miyasato?
Chair Hart and board members, and my preference is to expedite these, particularly if they are related to departments that are in their COVID response. So we would work with HR to expedite these, not bring these to the board unless they were not related to COVID or we felt there were other reasons.
Thank you for that. Any questions for staff? Any discussion? Is there a motion?
I move staff recommendation.
Motion's been made. Is there a second?
Second.
Supervisor Williams, thank you. Could we have a roll call vote?
Mr. Lavanino?
Aye.
Mr. Williams?
Aye.
Ms. Hartman?
Aye.
Mr. Adam?
Aye.
Chair Hart?
Aye.
Motion passes unanimously.
Thank you.
The next item is Department Item 3. Could the clerk please read the item into the record?
Chair Hart and members of the board, departmental item number 3 is from Planning and Development. It is a hearing to consider recommendations regarding the Historic Landmark Advisory Commission's designation of the Sheldon House as a county historic landmark. This is in the 1st District.
Mr. Chair, members of the board.
Go ahead and get a seat. You don't have to do it while you're standing up. We have time.
Oh, thank you.
There you go.
As Ms. Alexander read into the record, this is an item to designate the Sheldon House in the 1st District as a historic structure. I have Sean Stewart from Development Review here to make the presentation.
Mr. Stewart, nice face covering.
Thank you. Good morning, Mr. Chair and members of the board. The item before you is to consider adopting a resolution to designate the Sheldon House as a county historic landmark, which was nominated by its current owners for landmark designation. The recent resolution adopted by the Historic Landmark Advisory Commission is set to expire on April 12th, unless your board adopts the resolution before you today. This slide shows you the home's location at 681 Buena Vista Drive in the Montecito area, as well as the current surrounding residential development. This area of Buena Vista includes some of the earliest land holdings in Montecito's 20th century development, and as a result, there is a concentration of historic and scenic properties in this area that are thematically related and include designs by other notable architects such as Reginald Johnson, Mary Craig, and George Washington Smith. Shown here is the Sheldon House shortly after its construction in 1918. The house reflects the heyday of Montecito estate development and was designed by James Osborne Craig, a notable local architect. James Osborne Craig played a vital role in the early development of Santa Barbara's architectural identity, which was influenced by the early California architecture coming out of the Monterey region, modeled after the Messini-Ortega adobe style of construction. And notably, the Sheldon House was Craig's first residential project. The home has retained a high degree of architectural integrity, and the exterior remains largely unchanged from its original construction. The home has a Spanish colonial design as demonstrated by its white plaster walls, red tile roof, wooden beams, a style that has become known to define our community's architecture. James Osborne Craig was a notable local architect who was praised for his influential and highly publicized designs, which also included the central court of the El Paseo. James Osborne Craig suffered an untimely death at the age of 33, and he was subsequently memorialized in Santa Barbara's Dean of Architects. He was recognized for his contribution to the foundation of our community's iconic style of architecture. Due to the untimely passing of James Osborne Craig, this home is one of the few remaining examples of his work, and its high retention of architectural integrity further support its designation as a county historic landmark. Staff recommends your board adopt the resolution included as attachment 1 of the board letter and designate the Sheldon House as a county historic landmark. Staff also recommends that your board determine the adoption of the resolution is exempt from CEQA. And this concludes staff's presentation. And in closing, I just wanted to deliver the message that the Historic Landmark Advisory Commission appreciates your consideration of the nomination and would have been here today in person were it not for current health restrictions. Thank you.
Thank you, Mr. Stewart, for the presentation and the wonderful pictures. Supervisor Williams, this is in your district.
I support staff recommendation.
Okay. Is there any questions for Mr. Stewart or the staff or anybody? Okay. Motion's
Yeah, I
been-
actually have one.
Yes, Supervisor Adam?
Yeah, is there a tax benefit to the owners?
Supervisor Adam, through the chair, I'm not aware of a tax benefit. I am aware of certain historical structures do get benefits under the building code, historic building code, but I'm not aware of any tax benefits.
Okay, good deal, thanks.
There's been a motion, is there any public comment?
Chair Hart, members of the board, we have no request to speak on this item.
Okay.
Second.
Motion's been made and second. Could we please have a roll call vote?
Mr. Lavanino?
Aye.
Mr. Williams?
Aye.
Ms. Hartman?
Aye.
Mr. Adam?
Aye.
Chair Hart?
Aye.
Motion passes unanimously.
And please extend our thanks and gratitude to the Historic Landmarks Commission for working diligently to bring these wonderful treasures to our attention and to designate them as landmarks. Thank you. Number 4? Yes. We're now to department item number 4. Could the clerk please read the item into the record?
Chair Hart, members of the board, departmental item number 4 is from Planning and Development. It is a hearing to consider recommendations regarding accepting the California Coastal Commission's conditional certification of the Agricultural Employee Dwelling Coastal Zoning Ordinance Amendment, case number 18 ORD 3, as an amendment to the county's Certified Local Coastal Program.
Thank you, Ms. Plowman.
Mr. Chair, this item is returning to us after the Coastal Commission has made comments on our Ag Employee Dwelling Coastal Zoning Ordinance amendments. We did a fair amount of work with them to come up with a compromise on the recommended changes that they had for the ordinance, and I have Jessica Steele from Long Range Planning here to make the presentation, and David Lackey, who's her supervising planner. He's available to answer any questions about that process.
Thank you. And Ms. Steele, just a moment while we prepare your workstation. Thank you, Ms. Carbajal, for doing the hygiene that we all want everybody to be practicing at home.
Good morning, Chair Hart and Supervisors. Again, my name is Jessie Steele, and today I'm going to be presenting the Agricultural Employee Dwellings Local Coastal Program Amendment. On December 11th, 2018, the board adopted the Agricultural Employee Dwelling, or AED, Ordinance Amendment, which was Ordinance number 5069, and it amended the permit requirements of Article 2, the Coastal Zoning Ordinance, to streamline the permitting for AEDs in the coastal zone. The board also adopted a resolution authorizing staff to submit the AED Local Coastal Program Amendment, or LCPA, to the Coastal Commission for review and certification. On February 13, 2020, the Coastal Commission conditionally certified the LCPA with 5 suggested modifications, which are included in Attachment 1. Today, the Board will consider accepting the Coastal Commission's conditional certification by adopting a resolution, which is included as Attachment 2 of the staff report. If the Board accepts the conditional certification, staff will submit the resolution to the Coastal Commission. The Commission's Executive Director will then make a determination that the county's action is legally adequate to satisfy any specific requirements set forth in the Coastal Commission certification order and report this determination to the Coastal Commission at its next regularly scheduled public meeting. If the Coastal Commission does not object to the Executive Director's determination, the certification will be deemed final and the AED LCPA will go into effect immediately in the coastal zone. The Coastal Commission conditional certification letter includes 5 suggested modifications to the AED LCPA. Suggested modification number 1 updates the list of permitted uses in Article 2 to reflect changes resulting from the certified ADU and cannabis LCPAs. These LCPAs were certified in late 2018 and 2019, around the same time that the Board adopted the AED ordinance amendments. Due to this timing, the AED Article 2 amendment did not reflect changes from the certified language of the ADU and cannabis LCPAs. To ensure that the AED LCPA does not inadvertently undo this previously certified language, suggested modification 1 includes language from the ADU and cannabis LCPAs, which are currently certified in Article 2. Suggested modification number 2 adds language to clarify the permitting and processing requirements for AEDs, including principally permitted uses and non-principally permitted uses, which are PPUs or non-PPUs. A PPU is a use that clearly carries out the designated land use and intent of a given zone. A PPU requires a coastal development permit, or a CDP, and is not appealable to the Coastal Commission. A non-PPU, on the other hand, is appealable and requires a CDP with a hearing, or a CDH, or a conditional use permit. When Article 2 was originally certified as part of the county's LCP, Article 2 simply identified uses that require a CDP and those that require conditional use permits. It did not specify whether uses were principally permitted or not. Then in 2018, the Coastal Commission required the county to identify PPUs and non-PPUs as part of the certification of the Gaviota Coast Plan in order to adequately execute the provisions of Section 30603A4 of the Coastal Act. So consistent with the Coastal Commission's previous direction, suggested modification number 2 amends Article 2 to distinguish between AEDs that are PPUs and those that are non-PPUs. It also adds language to the AED permit requirements and development standards table to clarify that AEDs are allowed in zones where single-family dwellings are allowed, and to clarify that AEDs may require a development plan, depending on the project's total square footage and zoning. The Coastal Commission was generally supportive of the Board's action to downshift the permit requirements for AEDs, which are included in the top table here. For consistency with the Coastal Act, the Coastal Commission established different permit levels for AEDs that are PPUs and those that are non-PPUs, as shown in the bottom table. Here, AEDs for 1 to 4 employees in the Ag 1 and Ag 2 zones are PPUs that require a CDP and full-time on-site employment on the farm or ranch upon which the AED is located. These changes ensure that AEDs are supportive of on-site agriculture as the primary use of the property. AEDs for 5 to 9 employees in the Ag 1 zone, or for 5 to 24 employees in the Ag 2 zone, are considered non-PPUs and require a CDH. In the Ag 1 zone, such AEDs require full-time on-site employment, and in the Ag 2 zone, they require a majority full-time on-site employment, meaning 51% or more of the employee's work must occur on the farm or ranch upon which the AED is located.
Supervisor Williams. So I do not find these modifications as minor. I mean, was it Coastal Commission's intent, staff's intent, to make Carpinteria essentially unable to do agricultural employee dwellings? Because by using full-time on-site versus within a distance, or majority full-time on-site, it makes it impossible to actually execute this, since most of these operations have multiple sites and multiple businesses. So what was the discussion with, so, you know, essentially, if someone was going to be a farm worker employee, the only way that it would work in the coastal zone is if somebody is at one site that's maybe a 3-acre site, and part of the year they work there, and part of the year they work at another site that's a 5-acre site that's a mile away. So what was the discussion with Coastal Commission staff about this provision?
Mr. Chair, Supervisor Williams, first I want to say that there's no restriction if you get a conditional use permit on where the employee is working.
Yeah, but the whole point of doing this whole ordinance in the first place was to make sure they don't have to do conditional use permits, because otherwise we could have just not messed with the ordinance in the first place.
Right, right. So I can add, I mean, David or Jesse did most of the negotiating, but it was not a simple negotiation with them. We went back and forth a few times about the amount of restriction that they were applying to the program. But Mr. Lackey, would you want to respond to that?
Supervisor Williams, through the chair. So we had worked with the Coastal Commission staff. They had their initial draft modifications, and we were actually able to move them from their original point and actually getting greater flexibility. Supervisor Williams, one of the points that you wanted in the board's change was to add the language for citing the ag employee dwellings to avoid prime soils to the maximum extent feasible. They had proposed to remove that and not include it, so we were able to move them back to retain that point for flexibility. But a lot of their position was consistency with Coastal Act policies that seek to maximize the amount of available prime land for agricultural purposes. And so that was their main position on both the permit levels and the employment location.
And on-site, does that include the same business? What does that mean, on-site? If they are working for a company that has another parcel, you know, a block away or a mile away, is that on-site or not?
Supervisor Williams, through the chair. So it's relating to the on-site where the ag employee dwelling is to be located. So it would be employees that were working on those parcels where the agricultural employee dwelling is proposed. And it's related, their Coastal Ag policy consistency looks at the prime soils in agriculture on that premises and the relationship of the intensity of additional housing. The Coastal Act recognizes that ag employee dwellings are a supportive and necessary part of agriculture, and that for the more discretionary permit levels, it provides additional flexibility for the location of employment.
Well, that doesn't seem like they are interpreting the Coastal Act in a way to allow that, because we used to have, under the pre-existing rules, you could do it with the CUP, and we got zero production. In fact, we had negative production of agricultural employee dwellings in Carpinteria, negative production, meaning we lost existing ones because nobody wanted to rebuild. Whenever there was a county enforcement action, people would just knock them down because they can't get them permitted. And our whole intention of doing this was so that people could build agricultural employee dwellings. And so now the Coastal Commission is giving us amendments that make the whole exercise worthless in the coastal zone, meaning you say, well, we can still do it with a CUP. Well, that under those rules, none were getting built. And so I just, I don't find these minor. I find this to be a complete invalidation of the board's work and the democratic process for the coastal zone. And so that is my preview, and believe that we should reject these changes.
Mr. Chair, Supervisor Williams, I understand your concerns, and I think we share your concerns. We brought them forward because we thought that they made some minor improvements to what we currently have today. But, I mean, it's up to the board whether or not they want to reject these completely. That's possible, but it will basically eliminate any changes that we made to try and make any improvements. And I agree that it's a challenge to work with the Coastal Commission staff, and I feel like we made as much movement as we could with respect to the changes that they wanted, but they weren't willing to budge on this.
Why don't we go through the rest of the presentation, then we'll have a more in-depth discussion. Thank you.
So where we left off, the AEDs for 1 to 4 employees in the Ag 1 and Ag 2 zones are considered PPUs that require a CDP and full-time on-site employment. And then AEDs for 5 to 9 employees in the Ag 1 zone and for 5 to 24 employees in the Ag 2 zone are considered non-PPUs that require a CDH. In the Ag 1 zone, such AEDs require full-time on-site employment. In the Ag 2 zone, they require majority full-time on-site employment, meaning 51% or more of the employee's work must occur on the farm or ranch upon which the AED is located. And the Coastal Commission made these changes so that the employment location requirements of the Ag 2 zone would more closely match those proposed for the Ag 1 zone. And these changes were also intended to balance the amount of housing relative to agricultural land uses and to avoid taking land out of agricultural production for housing. Suggested modifications number 3 and 4 revise the findings for approval of AEDs in the Ag 1 and Ag 2 zones. Here, the Coastal Commission's proposed deletions are shown in red double strike-through text, and proposed additions are shown in blue double underlined text, while the board's approved text is shown in black underlined text. The findings have been expanded to require that AEDs avoid both prime and non-prime agricultural land, but the phrase "to the maximum extent feasible" gives the county some flexibility and discretion in satisfying this requirement. The findings have also been revised to require that AEDs be sited and designed to maintain the viability, as opposed to the productivity, of agricultural resources on the subject property and adjacent properties. These findings are consistent with existing agricultural resource protection policies of the county's CLUP and the Coastal Act, which address the viability and preservation of existing agricultural uses. Lastly, suggested modification number 5 makes minor changes to the AED permit requirements in Table 18-2, which is the Gaviota Coast Plan overlay table. And these changes were made for consistency with the new permit levels proposed by the AED LCPA. The Gaviota Coast Plan was certified in November 2018, 1 month before the board adopted the AED ordinance amendments. So the AED amendments did not include changes to Table 18-2. Suggested modification number 5 simply clarifies that the AED amendments apply throughout the coastal zone, inclusive of the Gaviota Coast Plan area. On December 11, 2018, the board determined that the negative declaration adopted for the 2015-2023 Housing Element Update, which is included in Attachment 3, fulfills the environmental review requirements for the AED ordinance amendments, and no subsequent environmental document shall be prepared pursuant to CEQA Guidelines Section 15162. In addition, Public Resources Code, Section 21080.9, and CEQA Guidelines, Section 15265, provide a statutory exemption for activities and approvals by a local government to adopt a local coastal program, and it shifts the burden of CEQA compliance to the Coastal Commission. Thus, the board's action to accept the Coastal Commission's suggested modifications to the AED LCPA are exempt from further environmental review. In conclusion, staff recommends that your board take the following actions. First, receive notice of the Coastal Commission's conditional certification of an amendment to the county's local coastal program with 5 suggested modifications. Next, adopt a resolution acknowledging receipt of the Coastal Commission's conditional certification with modifications, accepting and agreeing to the suggested modifications, agreeing to issue coastal development permits for the total area included in the conditionally certified local coastal program, and adopting the LCPA with the suggested modifications. Next, we recommend that you determine that the board's action is not subject to CEQA, pursuant to Public Resources Code, Section 21080.9, and CEQA Guidelines, Section 15265. And lastly, direct the Planning and Development Department to transmit the adopted resolution to the Executive Director of the Coastal Commission. Staff is now available to answer any other questions you may
Mr.
have.
Chair, there's a couple things I want to add, and Ms. Steele, can you go back to the table? I just want to clarify what the current coastal zoning ordinance says, and in Ag 1, which is primarily what is in Carpinteria, it requires a major conditional use permit for 5 or more employees. So with the changes, you could have one, so we have a downshift to a CDPH and a minor CUP. So there is an improvement there that will still remain. It's not what we wanted, but it is a minor improvement, I'd say. I mean, to get a CDP or a CDPH is less of a process than to get a major CUP or even a minor CUP. And then with minor CUPs, you could have 4 or fewer. So we do have a downshift. It's just not what we had hoped it would be. So I certainly would support at least adopting these, because I think it does make these minor improvements. And I know it's disappointing and a challenge, but I would prefer to have these in place than what we currently have in place.
Thank you, Ms. Steele, for the presentation. Thank you for those additional comments, Ms. Plowman and Supervisor Williams.
I know that the normal process is that we can either accept or reject each modification as we go, and then of course if we reject any modification, it goes back to the Coastal Commission, which this last time has taken a year. I guess my question is it within our discretion to instead clarify a definitional question of what on-site employment constitutes? I mean, from my perspective, the intent of preserving prime soils and agricultural is served if you define on-site employment as being an existing business, an ancillary part of the business that is within a certain radius. And because this is paring down of a paring down of a paring down, which at the end of the day means no more. This isn't going to help any production of ag dwelling units in the coastal zone. Right?
Mr. Chair, Supervisor Williams, so what I think I'm hearing is, could we return to the Coastal Commission staff and suggest to them that perhaps, particularly in the Carpinteria ag overlay, that where there is a landowner that has multiple properties that are in agricultural operation, that they could select a single site, perhaps that had the best non-prime soils to locate the housing on, that could we consider that on-site employment? I mean, I agree with you that it doesn't make any sense when you've got, let's say, the Van Wingerdens, where they have 6 or 7 parcels that they're currently operating. Why not pick the site that has the least amount of prime soils and build the housing there?
You know, and for avocado folks, they have a different, they also, this isn't just true of flowers, this is true of avocados, it's true of everybody, that
Sure.
they have multiple sites for one business that is all close enough to get around by a bike to. In Carpinteria, it's all a hop, skip, and a jump.
Yeah. I would like to ask Mr. Lackey, are we bumping up against any of those deadlines that require action by the Coastal Commission, so that if we were to continue this hearing and return to the Coastal Commission staff to see if we could renegotiate that aspect of the ordinance amendments, would we then have to withdraw and resubmit?
Thank you, Ms. Plowman, and through the chair, and I think council may also add, I mean, in the February Coastal Commission hearing, they conditionally certified the amendments to include their modifications. That conditional certification extends for 6 months, and so if it's not accepted, it would expire in August of 2020. So that's kind of the existing time frame that we're working with. So certainly the board could continue this item to get additional input and direction. It would provide at least an opportunity for us to convey to the Coastal Commission staff the issues that are currently with some of the modifications. Generally, if the board seeks to make some additional changes, it would need to be through a withdrawal of the existing LCPA and a resubmittal, and then that would have to go back to the board essentially to adopt a new ordinance and then resubmit that ordinance.
Mr. Gazzoni.
Mr. Chair.
Supervisor Adam.
Well, they knew that when they adopted it the way they did. And I just wanted to tell Supervisor Williams, if you're looking for somebody to help reject this thing, I'm here for you.
Thank you for that. Mr. Gazzoni.
Chair and Supervisors, I'm in general agreement with planning and development on this. We're using August 13th as the expiration of the conditional certification, and perhaps a fine point, but I think the 4 options are to accept and initiate new amendments, reject, or revise and resubmit. Technically, once the Coastal Commission has acted, that ends the negotiations with them, but would still allow a revise and resubmit, and staff could have informal discussions, as part of that. But I think of it as 4 fingers up in the air for options.
Thank you, Supervisor Williams.
The second of those 2 options you said was to accept but modify?
I'm referring back to something that Director Plowman had said, which was that her thought was one option would be to accept and then pursue additional amendments. So you could, again, the 4 options that I'm holding up figuratively are accept as is, related to that, accept and then pursue new amendments for the things that you disagree with, reject outright, or revise and resubmit, which would be for Supervisor Williams on the idea of defining any terms that would be part of revise and resubmit.
Well, I guess my thought is that revise and resubmit, changing the definition of what on-site employment seems the most substantive route to pursue. I mean, you guys could change my mind if you say that just reject outright sends a stronger message, but I don't think accepting it and letting the Coastal Commission pretend that they actually did anything to help agricultural employees is a good place of bargaining. It seems very weak leverage to accept the amendments and then come back and ask, pretty please, can we fix it later on? But I would love to know staff or my colleagues' thoughts.
Mr. Gazzoni, I think, has a comment.
Chair and Supervisors, I was just going to lateral to Director Plowman on the idea of that if the board was interested in revising and resubmitting, really talking about the mechanics of that, because I don't believe that we're prepared today to have substitute language.
Okay.
And again, we're looking at just penciled in there the August 13th expiration of conditional certification, so there is time to do this revise and resubmit option.
Ms. Plowman?
Yeah, Mr. Chair, we certainly could proceed with a revise and resubmit. It probably wouldn't take a substantial amount of work because we essentially have the ordinances drafted, and we have some of their changes which we potentially can live with, and then we would maybe make a modification to that definition. So if that's your pleasure, we can go ahead and do that. And I think the other option is accept these, because that'll take time, right? That'll take probably another year and a half. So the other option is to accept these the way they are, and then, at some point pursue a revision to that definition. And that would be included in one of our zoning ordinance amendment packages. But again, our zoning ordinance amendment packages are part of what our work program are, which we'll be discussing next week. And one of the options is to continue, not do one this next fiscal year. So we have to weigh that in also as a factor. So, Mr. Lackey, well, how much time do you think it would take for us to, if they decided to go ahead and reject and we wanted to rise and resubmit the very same package? What do you think that would take on from our staff's perspective?
Ms. Plowman, through the chair, we would want to obviously coordinate with Coastal Commission staff to convey the concerns that the board has. We would then formulate essentially a revised ordinance to bring back to the board. So I could see that, both of those happening for potentially a board hearing towards the end of May, in terms of just the docketing schedule to get that ordinance before you. And then we would resubmit that to the Coastal Commission. It technically starts a new clock. In the past, when the department and the board has sought to resubmit an LCPA, because a lot of the issues have already been dealt with, we were able to work on a more expedited time frame, so we can at least gauge that with our initial conversations with Coastal Commission staff of when we might be able to actually get that back to the Coastal Commission. I would presume if it follows past form that it could be towards the end of the summer or early fall that it'd be back at the Coastal Commission.
Mr. Gazzoni had a comment.
Chair and Supervisor, I'd just like to go back for a second on another distinction between rejecting outright and revising and resubmitting is that rejecting outright would then require beginning again at the Planning Commission, whereas revising and resubmitting, which would be accomplished in part today through continuing the matter with direction to staff to come back, would allow you to keep the ball here at the Board of Supervisors versus sending it back to the Planning Commission through a rejection.
Thank you for that. Supervisor Hartman also wanted to get in. Do you want to
Yes,
continue?
I'm concerned about our strategy to redefine on-site. It may have meaning elsewhere, and it seems like it was a pretty direct rejection of other properties. I'm wondering if a different strategy might be to look at as I think you were implying, Director Plowman, the greenhouse overlay, and whether we could offer that as something slightly different, because there are tremendous housing pressures in that area. And if we could use that as a slightly different strategy, and there may be others, maybe you could come back. So we're not just going back to the Coastal Commission saying, take what you rejected. We're modifying it a little bit so that they might actually be moved to do something differently.
Mr. Chair, Supervisor Hartman, I think that's a good point. I do want to share with the board that we did try to renegotiate this and make this point with staff previously, and they rejected it. So I'm not hopeful that they will accept it. I think that then the fight goes to the meeting when it goes to the Coastal Commission, and then we have to be there to explain to the Coastal Commission why we object to staff's rejection of our proposal.
And what's their reasoning? Again, if they want to protect prime land, this seems to fly in the face of their own purpose.
Mr. Chair, Supervisor Hartman, I tend to agree with you, but they did not. And they didn't really give any more reasoning other than their primary objective was to preserve prime agricultural soils. I think that's their, they use that as a fundamental underlying principle for them, and housing really has not risen to that level in the coastal zone. They don't look at it the same way as they do public access or agricultural resources or other items that are sort of fundamental to the Coastal Act. So I personally would like to see a change in that, because I think housing in the coastal zone is just as important as it is in the inland areas, but we haven't been that successful in making that argument with staff.
Supervisor Williams.
Well, then I would advocate that we revise and we continue this and revise and resubmit in May, and that we change the definition of what on-site employment constitutes. If it is Ms. Hartman's preference to just do it in the Carpinteria Ag Overlay, then I'm agreeable to that. But you know, I leave it up to you guys. Also have areas of the coastal zone, so you know, while the intent of moving this was for this part of the ordinance was for Carpinteria, it also affects your areas. So to me, the question of whether to revise and resubmit for the whole coastal zone or to revise and resubmit with the definition change just for the Carpinteria Ag Overlay, it's up to you.
Supervisor Hartman.
Maybe P&D could come back with some different options that look a little different than what we already were rejected on, so that we can at least make a plausible argument that we really have revised it.
Yeah, I think that's worth knowing. And, you know, I think the tension in my mind is the staff time and effort to do this. You know, it's a zero-sum game, and we're concerned about, you know, being able to move the long-range planning agenda. And, you know, this is I won't use the football analogy, but it's the fourth quarter, and there's 2 seconds on the clock, and the idea of getting the Coastal Commission to change their minds is the small odds of success. So I don't know how much this is, but I understand it's worth.
Well, I mean, I do think there is some. I mean, you know, the process that Ms. Hartman and I engaged in with the Coastal Commission on Gaviota did have some fruits and changed their mind on some things. It was not a complete victory, but I mean, it may behoove us to elevate this discussion. I mean, you know, not only to elevate it to staff being able to actually talk with property owners that would build agricultural employee dwellings, but maybe board members as well of the commission. So, I mean, I guess I wouldn't think that making an amendment and then just letting it be on cruise control would be a smart thing. To me, we would want to amp up our outreach and our ask to the commission to actually touch bases with people who might actually create agricultural dwellings, and to let them know that the existing rules that they're trying to essentially re-prescribe over us has not produced any dwellings, even though the demand for housing and the production in Carpinteria, would remind you guys, is the lowest per capita in the entire county. Even adjusting for our smaller population, we're doing a worse job than anywhere at producing housing. And so it's an important and needed issue to address. So I guess I am fine with just giving them one direction to reduce staff load. And I would just, but I would hope that we would revise and resubmit either on one direction or on two possible directions to limit the amount of staff time that has to be used on this.
Do we have any public comment?
Chair Hart, members of the board, we have one request to speak on this item.
All right, let's go to that, and then we'll come back for motion.
Alrighty, we are going to Andy Caldwell on the phone.
Mr. Caldwell? Oops, excuse me, you're not there yet. Mr. Caldwell?
Chair Hart, members
I
of
just,
the board,
just
I'm Andy
before you
Caldwell,
get going,
representing CoLab.
can you just pause for a second?
Yeah.
I just want to apologize for having to cut you off last time. I know this is challenging because you don't have a clock to look at, but if I can, when you get past your 3-minute comment, I'm going to try and intervene so you can hear me and bring you to a close if you don't mind. Thank you.
So, Supervisor Hart, it's nearly impossible to hear you. I'm not sure why. As you know, I always try to, I hope you haven't started the clock yet. I always try to respect that clock. It is nearly impossible to hear you. And in fact, I'm watching on my computer, and it's delayed. There's a delayed time, so I get to hear when you're interjecting. I can't hear you. So I don't think I'm going to hit your 3-minute mark this time, but the bottom line is it's nearly impossible to hear you.
Thank you for that clarification. That's helpful.
All right. Chair Hart, members of the board, Andy Caldwell representing CoLab. I agree with Supervisor Williams' early assessment that this thing is worthless as it's been sent back to you by the Coastal Commission. I think you have a letter from the Flower Nursery Growers Association to that effect, and then plus Lori Tamura, who does a majority of planning for the farming community throughout this region. You know, the bottom line is you're kind of fooling yourselves because what you're asking them to do is to go back and concede to what we originally asked as if there was a lack of understanding. There's not a lack of understanding. There's a lack of will on their part. And what I wish you would do is a couple of things. One is send a letter to the governor and the state legislature telling them that the State Coastal Commission needs to get the memo that we need more housing, and in fact we need more farm worker housing, and we need more housing in the coastal zone. Secondly, something needs to change here. You're elected leaders, and you have an approved coastal plan, and you're trying to meet a need here, and staff of the Coastal Commission basically gives you a thumbs up or a thumbs down, a live or die order. Why are there not conversations between elected leaders and the Coastal Commission members who themselves are appointed instead of going staff to staff? You know, this system needs to change. And the bottom line here is the Coastal Commission staff should not be the all-supreme authority on issues affecting good planning. And as Supervisor Williams says, Carpinteria is in a bad place, Ag is in a bad place down there, and they're doing absolutely nothing to help agriculture or the farm workers that are otherwise needing to commute. So again, I think policy direction needs to be sent to that Coastal Commission from on high, and I wish you would go that route and just reject this and send Supervisor Williams to the hearing before the actual Coastal Commission members versus their staff. Thank you.
Thank you, Mr. Caldwell. You're well under your 3 minutes that time. Okay, it matters back to the board. Supervisor Williams.
It sounds to me like the best route in order to get in front of the Coastal Commission fastest, but to not roll over and make sure that this could actually do something good, is to continue this until May and have staff bring forward a recommendation to revise and resubmit with a definitional change to what constitutes on-site employment. And I guess two options for a definitional change. One definitional change just for the whole coastal zone, and one for just the carpentry ag overlay.
Is that a motion?
That is a motion.
Motion's been made. Is there a second?
Second.
Any discussion of the motion? Roll call, please.
Mr. Lavanino?
Aye.
Mr. Williams?
Aye.
Ms. Hartman?
Aye.
Mr. Adam?
Aye.
Chair Hart?
Aye.
Motion passes unanimously.
Thank you for that extra work, Supervisor Williams. We'll now recess to closed session. County Council, can you please read the items for consideration?
Chair and Supervisors, I will. And first, I would like to acknowledge the electronic participation of Deputy County Counsel Jenna Richardson, who was back and forth with me on some of the arcane questions today. Thank you, Jenna. And in closed session today, the board is agendized for consideration of two matters of litigation, existing litigation. The first is AC et al. Versus County of Santa Barbara, a U.S. District Court case. The second is Crown Castle Fiber LLC versus County of Santa Barbara, also a U.S. District Court case. My estimate for closed session is about 45 minutes.
Thank you, Mr. Gazzoni. We'll return from closed session when we are finished. Do we have enough? Do we have the folks in? Yes, we got 3, okay. We're now reconvening the meeting of April 17th, 2020. Will County Council please report out from closed session?
Chair and Supervisors, today in closed session, the board considered 2 matters of existing litigation. The first, AC versus County of Santa Barbara in U.S. District Court. The second, Crown Castle Fiber LLC versus County of Santa Barbara, also in U.S. District Court. There are no reportable actions. That ends my report.
Thank you, Mr. Gazzoni. We'll now adjourn to Monday, April 13th, 2020 for budget workshops. We are adjourned.